Hello. Wanted to thank you, the scientific committee, for allowing us to present our data. Sorry. So no disclosures. Since 1996, the retropubic mid-urethral sling has become the gold standard. And although there's been a lot of studies looking at the outcomes and success rates, we couldn't find any data looking at long-term voiding parameters in women who had a retropubic mid-urethral sling. So we thought that looking at that would help us maybe counsel or inform better our patients on the long-term complications or implications of the mid-urethral sling, not just if they're going to be dry or not. So we looked at all the patients who had a mid-urethral sling retropubic before August 2011, so more than 5 years since we started the study. And the exclusion criteria was women with chronic voiding dysfunction, neurological disease, a failed retropubic after that. And the patients were contacted or tried to contact and invited to attend for a consultation and then asked to fill some questionnaires, patient-reported outcome tools. At the consultation, we examined them for pelvic organ prolapse and checked for mesh exposure, and we performed a cough stress test and a scan, and a uroflowmetry to check the flow. And all data was collected and analyzed. So 240 were eligible. It was rather difficult to contact them after so long. So we gave up after 3 attempts, leaving messages of contact number was disconnected, the deceased, or the change address. So 103 were reached and accepted to participate, but of those, only 28 agreed to come for consultation and Euroflow. So on the demographics, the mean age at the time of surgery was 63, and the mean age when they were seen was 70. So 85-month mean follow-up. Parity to previous hysterectomy, 44%, previous prolapse surgery, 11%, previous stress incontinence surgery, 12%. Only 25 had concomitant surgery, so there's not a lot of people with prolapse. On the pre-op urodynamics, voided volume was 190, Qmax 24, and a small residual of 20 as a median. Maximal urethral closure pressure 20, lick point pressure 60, and the true overactivity was present in 20%. Subjective and objective outcomes when they were seen. So, although some of them reported they were still leaking, the PGIS was reasonably high at 2. ICIQ-UI was 5 as a median, and ICIQ-OAB 5 as well. The WI-PSS is the one that we use for the voiding parameters. So if you're not familiar with it, the maximum score would be 35. So 9 is reasonably good. And the force of stream, we asked them on an analogical scale of 1 to 100, how was their force of stream? And on average was 50, but it tend to be over that. So on the ones that came, we could compare before and after surgery, the Euroflow. And although the Qmax and the residual was statistically significant, it was not clinically significant. So at 85 months, 65% had median PGIS of 2, so they were reasonably happy with the surgery. And the lower Qmax and high residuals were probably due to age alone, or could be due to age alone. I think the other thing we noticed is that the voiding parameters vary very widely between patients, although they had the same sling, and the force of stream was 50, but not clinically significant. So I think in our study we could say that it looks like a mid-urethral sling in the long term does not affect the voiding function of the patients, and I think age has a role to play in it. Thank you.
Thank you very much. Question?
Just a clarification, but did you use the PGIS or the PGI?
No, PGIS, because we felt after 5 years, it would be like a new presentation. So it was an improvement, was symptom.
Yes, but you say that there was a 65% of women that were subjective cure.
Yeah, so
And then you say the median PGIS was 2.
Yeah. Yeah. So the success, the cure rate was with the ICIQ. So we looked at if they marked C, E, or CE. That is, do you leak when coughing, sneezing, or do you leak with exercise, or both? So the ones who tick that box, they were failures. Yeah. So the ones who didn't tick that was 65%.
And
so the PGI is how do you feel?
Yes,
feel
but
like
the PGIS, the median was
2.
Median or the mean was 2.
2 out of 4.
Yes, I know, but regarding all the population or just for the women who were subjective cure?
No, for all. So.